Okay, welcome to this afternoon's Committee on Health and Human Services. Secretary, will you please call roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadim, Wynn, Orntlicker, Chair Brown May.
Thank you. I am here. Please mark Assemblymember Wynn absent excused. Assemblymember Gray present when he arrives or absent excused if we go too quickly and we adjourn before he gets here. I apologize for being late. Okay, so as reminders as we get started today, first of all, welcome to the Committee on Health and Human Services. I know we had a noon start, so thanks for being here and ready to go. Silence your electronic devices, please. When testifying, make sure you turn on your microphone and clearly state and spell your name. Call-in is available online. To provide public comment or testimony, you can dial 888-475-4499. And today's meeting ID is 824-832-37988, and then press the pound sign. We will take public comment at the end of today's meeting. Our agenda and committee information is available on Nellis. We expect courtesy and respect. Committee members will be using their laptops. Okay, we have 3 bills on our agenda today. We will go in order, so we will officially open the hearing for Senate Bill 8. We will welcome our presenter to the table. Thank you so much for being here.
Good afternoon, and thank you for having me today. My name is Dina Schmidt, and I serve as the Administrator for Aging and Disability Services, and I'm here to introduce SB 8. The Office of Specialist for the Rights of Elderly Persons was established in 1989 during the 65th Legislature. In 1999, the duties of this position were expanded to include education, outreach, and advocacy. And then in 2017, the position was expanded and updated from the Specialist for the Rights of Elders to the Attorney, this is a mouthful, for the rights of older persons, persons with a physical disability, an intellectual disability, or a related condition. So instead of only serving the population over 60 years old, the position now serves all Nevadans across the lifespan. In 2017, AB 224 updated the language and definitions in NRS chapters 435, 433, 433A, and 433C. The term persons with a related condition was replaced with developmental disability. A developmental disability is a broader category and often a lifelong challenge that can be intellectual, physical, or both. Developmental disability is defined in NRS 435.007 as autism, cerebral palsy, epilepsy, a fetal alcohol spectrum disorder, or any other neurological condition diagnosed by a qualified professional. SB 8 is very simple and straightforward. This bill makes those same language changes throughout NRS 427A. Sections 1, 5, and 6 of the bill substitute the term person with a developmental disability for the term person with a related condition. Section 2 defines the term by using the same reference back to 435.007 so that our definitions are consistent. Section 3 changes the name of the attorney for the rights of older persons and persons with physical disabilities, intellectual disabilities, or developmental disabilities. Sections 4, 5, 6, 7, and 8 make conforming changes. So there are no changes to the duties, responsibilities, or activities of this position or within ADSD. This is a simple update to NRS language to more appropriately reflect the individuals served by ADSD. So with that, I'm happy to answer any questions.
Thank you for your presentation. Members, questions? Wow, no questions? Great presentation. Thank you so much for being here. Okay, going once, going twice, no questions. Okay, thank you. At this time, we'll open testimony in support of Senate Bill 8. If you're here to offer support for Senate Bill 8, please come forward here in Carson City or in Las Vegas. Seeing no one moving. AVH, is there anyone on the telephone line who would like to offer support for Senate Bill 8?
Public lines are open and working. There are no callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition. Is there anyone here who would like to offer opposition testimony for Senate Bill 8? No one moving here in Carson City or Las Vegas. AVH, is there anyone on the telephone line?
Public lines are open and working. There are no callers to testify in opposition at this time.
Thank you. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral? Please come forward. Seeing no movement here in Carson City and none in Las Vegas. AVH, is there anyone on the telephone line?
Chair, the public lines are open and working. There are no callers at this time.
Thank you, AVH, so much. We would invite our bill sponsor. No closing comments. Thank you for shaking our head. So we will officially close our bill hearing for Senate Bill 8. Is that our fastest one yet? Anybody know? Okay. Thank you. Thanks for the presentation. Okay, that officially moves us to the next item on our agenda. We will open the bill hearing for Senate Bill 84. Thank you so much for being here. It's great to see you. You may begin when you're ready.
Thank you so much. Liz Ortenberger for the record, LizOrtenburger. I am the CEO for SafeNest. And Senate Bill 84 does one simple thing. It strengthens the batterers intervention program to ensure evidence supporting not only the curriculum but also the handouts. Batterers intervention program is typically the one and only thing that we have for abusive partners looking anything like mental health support. Our survivors' families and communities deserve to know that that support is evidence-based. Thank you.
Another record presentation. Committee members, any questions? Okay, no questions. Thank you so much, Ms. Ortenberger. If you'll step back, we will open up testimony and support for Senate Bill 84. Anybody here who would like to offer support, please come forward at this time. No movement here in Carson City, none in Las Vegas. AVH, is there anyone on the telephone line who would like to offer support for Senate Bill 84?
Chair, the public lines are open and working. There are no callers to testify in support at this time.
Thank you. At this time, we'll move into opposition. Is there anybody here who would like to offer testimony in opposition of Senate Bill 84? Please come forward at this time, Carson City or Las Vegas. Seeing none, AVH, back to you. Anybody on the telephone line would like to offer opposition testimony?
Chair, the public line is open and working. There are no callers to testify in opposition at this time.
Thank you, AVH. This time we'll move into neutral testimony. Is there anybody here who would like to offer testimony in neutral? Okay, thought we had a taker, but we don't. No movement here in Carson, none in Las Vegas. AVH, is there anyone on the telephone line?
Chair, the public line is open and working. There are no callers to testify neutral at this time.
Thank you so much. Would you like to make closing comments? We are getting a no sign, so thank you. At this time, we'll officially close the hearing for Senate Bill 84. Thank you so much for being here. That moves us to the third item on our agenda today. We will officially open the bill hearing for Senate Bill 137, and we will welcome our distinguished Senator Neal to the table. You may begin when you're ready.
Thank you, Madam Chair. I have pretty much, she's my co-presenter, but she's going to present majority of the bill. Ms. Christensen, this was her idea, and this was by request. So I will let her start off with her opening comments.
Thank you so much, and it is good to see you, Senator Neal. Thank you for having me. My name is Soraya Woods, and that is spelled SOURAYAWOODS for the record. My testimony might be a little bit longer than the previous ones. This bill is near and dear to my heart, and I wanted to read just what a simple Google search provided because I think that it weighs heavy for this bill. It says, in Nevada, survival rates for out-of-hospital cardiac arrests are around 11%. That is alarming, with a significant portion of these cases occurring in homes. While bystander CPR can double or triple the chance of survival, it is only initiated in a small percentage of witness arrests, highlighting a need for greater community training. That is what this bill is all about. Only about 45.9% of witnessed out-of-hospital cardiac arrest cases receive bystander CPR before EMS arrives. And in Clark County, here locally, only 20% of cardiac arrest patients receive bystander CPR. EMS rates sometimes exceed 10 minutes before they even respond to a cardiac arrest. And so those people's chances of survival are significantly decreased if they don't receive bystander CPR. And so my goal with this bill is to foster a greater what's the word I want to look for? A greater avenue of resources for trained individuals. I want more people to be trained. I want more access for AEDs in the community. Ultimately, the goal is to reach out even wider and work with people such as homeowners associations and other communities to make CPR training necessary. Like, you have to do it. It has to be done, because that 11% rate is alarming. And of course, in the hospital, people are going to survive, but outside of the hospital, most likely they are not, if we're looking at an 11% rate. So I remember having a friend of mine who got up from dinner at Thanksgiving and fell out of his chair. We went to school together. I'm 50 years old, so this was maybe about 8 years ago. And nobody in his family knew CPR, and he did not survive. We were really good friends. And that broke my heart, because the one of the other statistics that I learned is that if just one person in every other household knew CPR, we could cut heart-related deaths by half. And so we never know who it may affect, where it may strike. It has no race, gender, socioeconomic. It doesn't matter who you are, it can affect you. And I just want somebody to be able to save you if it does affect you. And so that's my goal with this bill. Thank you.
So with that, Madam Chair, just open up for questions.
Thank you, Senator. Thank you so much, Ms. Woods, for your presentation. We appreciate you being here and sharing the story. Members, do you have any questions? I do have a couple. Thank you so much. I appreciate that. On page 2, sub 2B, allow volunteers who are certified in CPR by a nationally recognized organization to register to authorize a division. Can you just talk through a little bit what division are we registering with, and who will oversee that registry?
So, Senator Neal, for the record, so the division is the Division of Public Behavioral Health, and basically that is the division that's referenced in here. So when we had the hearing on the other side, the American Heart Association was one of the major supporters, because they're familiar with creating the heart safe community. And so although this bill is trying to expand and create more folks to be CPR prepared, it is not out of the bandwidth of what already the American Heart Association is already doing. And so this is just an expansion upon that work. And so when we looked at the Division of Public Health, they said that they could absorb this and there would be no fiscal impact upon the absorption of this program, that they had the capacity to do this.
Thank you, Senator, for that clarification. As a follow-up, and I appreciate that, right? The American Heart Association does really good work, and lots and lots of folks are trained in CPR. I'm curious to know, what about hold harmless, right? So if a bystander sees a person as apparently having a cardiac condition and does CPR, are there hold harmless conditions that have been considered as part of this registry?
I don't know, Ms. Woods, but I'll answer. So
I was just going to say that Soraya Woods, for the record. I was just going to say that all 50 states do have I can't think of the exact term, but the bystander law. So they're all covered by that law, that there's no recourse for somebody attempting to help somebody in good faith.
Thank you so much for that. Thank you for answering those questions. Members, any other questions? Okay, thank you so much, Senator. We'll ask you to step back. We'll open up testimony in support of Senate Bill 137. If you would like to offer support for the Senate bill, please come forward here in Carson City or in Las Vegas. Seeing no movement, is there anyone, AVH, on the telephone line who would like to offer support for Senate Bill 137?
The public line is open and working. There are no callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition testimony. If you're here wishing to offer testimony in opposition for this measure, please come forward. Literally no movement in Carson City or Las Vegas. AVH, is there anyone on the telephone line?
Chair, the public line is open and working. There are no callers to testify in opposition at this time.
Thank you, AVH. We'll move into neutral testimony at this time. If you'd like to offer testimony in neutral, please come forward. No movement here. AVH, one more time. Anybody on the telephone line?
Chair, the public line is open and working. There are no callers to testify neutral at this time.
Thank you. We'll ask our bill sponsor if you would like to make closing comments.
Senator Neal, for the record, I want to thank the chair and the Health and Human Services Committee for hearing this bill so quickly. My other bills won't be so easy. I know it's Friday. You guys are like, don't ask any questions. Nobody will get shot. So thank you for the hearing.
Thank you, Senator. At this time, we'll close the bill hearing for Senate Bill 137. That moves us into the last item on our agenda, which is public comment today. If you would like to offer public comment here in Carson City or in Las Vegas, please come forward at this time. Seeing no one moving. IVH, is there anyone on the telephone line who would like to offer public comment at this time?
Chair, the public line is open and working. There are no callers to provide public comment at this time.
Thank you, AVH. That concludes our business for today, members. I will say happy Friday. This meeting is adjourned.